There's a trust between you and the doctor who's ordering that test. So I touched on a little bit of this before, but I'll just recall a little bit deeper to your question. I was a cancer diagnostics company where we were launching a test for folks like me, may have an elevated PSA, debating whether or not you had prostate cancer. We had a blood test that fit right in between that. And so there was a lot of energy. We raised capital to commercialize. We were in commercial launch. And as I mentioned earlier, every diagnostic test is not perfect. You have some that have a degree or percentage of false negatives where the test may say you're okay,
Yeah.
but you have a high risk for cancer. And I was not only the CEO and all, I was a chief sales rep. It's that stage of company, right? So sitting down with a doctor,
Wearing all the hats.
sitting down with a doctor, interpreting your tests that you developed and knowing that it had a false readout or a false negative for their patient. There's a trust between you and the doctor who's ordering that test. You get the story going in your head about how many other patients may have to be faced with that result. You have an investor thought of saying, wow, is this the end of my investment? And then you have the development side. Could we have done more to optimize the test more? I think with those and how do you work through it? I think for me is you candidly call it as you see it. There is a percentage of test results that will not be correct. That's the practical reality of it. You couch that with the reality is it's still a better solution than what's currently on the table with, in this case, men like me with an elevated PSA that's not really that great of a test. And so you learn to speak the truth, but also be energized and encouraged that it is the better solution out there and you persevere through. But it does, it adds a level of humility to the journey to know that you're just not going to get it right, but you energize the team around that and investors and keep going.